One of the things we hear over and over again is how patients would like to be treated with more respect and more kindness by the organizations that provide them care. Well, good news. According to the latest results and latest statements from Press Ganey, kindness is on the rise. I'm about to sit down with Deirdre Mylod, who is the executive director for Press Ganey's Institute for Innovation, as well as the senior vice president for research and analytics. We're going to talk about their latest findings and why she believes this kindness trend is actually going to continue. Let's get to it. Deirdre, welcome to the program.
Thank you. I'm glad to be here.
This is exciting. I haven't had a chance to sit down with too many folks from Press Ganey, so I'm really excited to talk to you about some of the statements that Press Ganey has come out with recently. But before we get to that, can you please share with our audience a little bit about you and your role at Press Ganey?
Sure. I've been with Press Ganey for 27 years. I started out doing survey measures and designing the surveys that if you've ever gotten a survey after going to the hospital or seeing your doctor or going to the emergency department in the US, that probably came from Press Ganey. And so I started out doing survey measures and design. Then for a period of time when government surveys were just becoming regulated, I led our public policy team and our compliance to government surveys. For about 10 years, I led our team of folks that help clients use the data that they get from these surveys, interpret it, and guide quality improvement. And for the last 13 years, I've led our Institute for Innovation. That's our nonprofit research arm. And I'm also SVP of Research and Analytics. As part of that, I get to convene sort of a think tank of folks thinking about the intersection of patient experience, employee engagement, safety. And I also, for the last 3 years, have been co-leading our equity partnership with my colleagues, Dr. Tejal Gandhi and Casey Willis-Abner. So I have the best job ever.
And it sounds like you joined them right out of grade school. I mean,
That's very
that's
kind of you. Right out of grad school at Notre Dame, the founding office for Press Ganey is in South Bend, Indiana. So, yes.
now I know Press Ganey is a very well-known name, but for a few that may not know Press Ganey, can you give us the quick 30-second overview?
Sure. What we're most well known for, either by the healthcare space or even by consumers, is if you've ever gotten a survey after you've had a healthcare experience. And we work with about 75% of hospitals in the US for their patient experience survey measures. Those are surveys going out literally every day. Somebody goes to the doctor and that record, we get alerted and we call them or text them or send them a mailed survey. So we're most well known for that. Work with about 95% of magnet hospitals, 95% of the top 200 hospitals, but we also measure the experience of staff. So the employees, physicians, their experience, well-being, the culture of safety. We are the largest patient safety organization, which gives people the ability to share safety data and learn from each other. And we also have a very large benchmarking database of nursing quality indicators. So really, we think of it as we help organizations improve the human experience in healthcare, whether that's the experience of staff providing care or the experience, safety, quality, compassion that patients experience.
Now, Deirdre, I'm I'm really excited to sit down with you because Press Ganey came out with a couple of statements that I found super interesting. And one of them was this, and I quote, "We have observed a steady rise in patient experience scores,
Yes.
nearly reaching pre-pandemic levels." So I
Yes.
want to ask you, in your opinion, has this recovery in scores been slow or as expected?
Oh, so I'm going to hone in on that word as expected. Was anything about COVID as expected, right? So all of this is new. But I think what you're getting at is where's the pace? What's going on, and was it sort of a slow and steady, or what we saw very briefly? So the idea of COVID, right? It was in the news, but we didn't have that many cases. We actually started to see an uptick in patient experience as people, I think, became worried about their health and also really appreciative about their health. And it was the largest month over month rise we'd ever seen. Typically, what we would see is, organizations work hard to improve, but it's hard to improve. So every year, our benchmarking databases get a little bit better and a little bit better and a little bit better. So what we saw at the beginning of COVID was this sudden spike, and then the reality of it set in. And during 2020, we saw it go down. And then we saw it go down further in 2021, go down further and kind of level off in 2022. And we didn't know, just like we saw the stock market change, all sorts of things changed. People's incivility on airplanes changed. What we saw then in 2023 was this rise back up. So it took 4 years or 3 years to get down to that point. And then in 2023, we've almost come all the way back up to pre-pandemic levels in the acute spaces. And so what was remarkable to us was the rebound in 2023, because it took a long time to get there. And then now we're coming back up. So we're within a point or 2 points of the scores or the way that patients would evaluate care pre-pandemic.
So Deirdre, I'm going to ask you about the other quote that I found
Okay.
other statement, sorry, from Press Ganey that I found
Okay.
interesting. And that was patients are noticing and reporting an increase in kindness
Yeah.
through care delivered, and caregivers are focusing on human elements of delivering care, and patients are noticing.
Yeah.
So lots to unpack there, but let me
Yeah.
start by asking, what are some of those human elements that caregivers are focusing on?
Um, so some of it are the things that they've always focused on. Some of it is, I think, a renewed appreciation for the human connection. So, for example, in an inpatient setting, um, there's practices that both keep patients safe and provide high quality, and also make them feel safe and make them feel cared for. So, hourly rounding or interval rounding, where people come in to see you on a proactive basis, or leader rounding, where somebody in management comes to check on you and see how things are going, or bedside shift report when nurses going off shift, instead of talking in the hall about your care, talk to you there, and sometimes even with the physician as well. So those are activities that people are re-engaging around reliably, but I think they're also talking about the way that those things build trust and relationship, not just this is a process that we're going to execute on because it's the way we provide care, but when we hourly round, we make people feel safe and we have the opportunity to have a moment with them. And staff didn't have those moments when they couldn't go in the room during COVID. We have the opportunity to meet someone's need, or when we're bedside shift report, we're passing the relationship from one nurse to another. It's a warm handoff. And I think it's being talked about more in those human terms, which is much more engaging for staff and mission oriented, instead of saying, we have a process and we want you to do this and we're going to make sure you do it this way. This is how you get to provide the best care and you get to be in relationship with patients. And I think it's that combination that's what we're seeing working so well.
And how does Press Ganey know that patients are noticing this increase in kindness?
Yeah, so that there's a couple of ways. So one is we're sending out millions of surveys. On a typical year, we would get back more than 1.5 million inpatient surveys. We'd get more than 6 million medical practice surveys for going to see your doctor's office. So those surveys have standard questions. Some are government required, some are additional. And they ask questions like how often you were treated with courtesy and respect, or how well you were listened to. And so there's very specific questions that are being answered. And that's what we were watching, those trends that I, pantomimed before, that things went up and then went down and now they're coming back up. So we're watching that, but we're also watching, is the trend the same for every single question? The direction is similar, right? Things went up and then they went down and then they got back up. But what we're seeing is that some questions are coming back faster, and some of the standard questions that we're seeing get closer to pre-pandemic levels are the ones that relate to relationships. So listening, feeling listened to, feeling respected, and feeling well communicated with. So that's one way that we know. The other thing that we do is we take comments. When patients write comments on their surveys, we have a natural language processing tool called Narrative DX, and we're abstracting themes. This is an insight, not just a whole comment, but even just a phrase or a part of a sentence. This is about a nurse or about a doctor. And it's not just that it's about a nurse, it's about kindness or professionalism or skill or humor. And so we can see when patients are talking about kindness, what they're saying and what they're appreciating. And then we can also see the numbers coming back up more precipitously for those topics.
It almost sounds like what your surveys and your data is indicating is that people are, or sorry, that clinicians are kind of being more human. You talked about humor, you talked about engaging,
Yeah.
and to just something you said at the top, it sounds like that's happening and that's being perceived as kindness.
Yeah. And I just want to, I think that clinicians have always been human, right? Because they are They are human beings providing care in really tough situations. I think the best organizations are giving them the space and the resources and the ability for that humanity to come through. And that we're being highly reliable about that humanity, and also making sure they feel safe, right? Because the rise of incivility, because their own personal safety during COVID, organizations had to really galvanize around what is our safety culture for you, our staff. And that tells them that they're safe and trusted and valued. And that gives them the emotional bandwidth to give that back to patients, even though their jobs are so hard.
I really like how you corrected me there. You're absolutely right. Like
In a
they
nice
are
way.
human, but organizations are finally giving them the space to be human, which
Mm-hmm.
is great, and be personable. So I like that. So Deirdre, do you think that this is a blip, or do you think that this is really, a sign of sustained change? Like, are we going to see these kindness metrics and kindness indicators continue to improve over the next few years?
I think the pace was a blip, right? Because we don't have to dig that far out. I think so. Some of this is, I think, coming back to a homeostasis. But I think we got there so quickly in 2023 because organizations are thinking differently about what it means to have safe care, resilient workforce, and compassion all coming together. So we also saw in the medical practice data, like, so going to see your doctor's office, that didn't dip during COVID. That actually kept going, and it's higher and higher and higher. So we know that we can keep pushing that envelope, that things can still get better. I think care is not always perfect. It's not always equitable. Like, there's still opportunities, but I don't think we're gonna see a seesaw going back up and down. I think we're coming back up. And when people experience the joy of providing care, I mean, that people went into healthcare because they found joy in serving others. The way organizations are making space for that, I think, is going to continue to reinforce that for patients.
So if you were speaking to a senior executive at a hospital, or as you speak to senior
Mm-hmm.
executives at hospitals, what advice do you give them on how to incorporate that personalization, that humanness, the kindness that you're seeing? How
Yeah.
would you recommend that they implement that, or bring that to their organization?
So I'm often, when I talk to executive leaders or boards, it's often because they have questions about the data, right? So I'm going to explain data to them, but I'm going to answer your question, hopefully at the same time. The metrics have to guide, like the metrics are the reality that's helping you see where quality is high or low or what needs to be done. But the metrics themselves have to be humanized. So they have to be able to talk about what their strategy is and then relate the strategy to the metrics in a way that resonates for people's mission, right? So what leaders have to be able to do is not say, we need to get our patient experience scores up, because no one went into medicine to get their patient experience scores up. And not even, I mean, it's a little bit easier to say we have to improve our safety metrics. We have to improve our serious safety event rate. But really what we're saying is we want to make sure that we are taking care of patients and helping them feel safe and be well and feel the compassion. And so when we translate, what we really help people do is to think about the messaging of what are you asking people to engage in, what behaviors and best practices, how are you going to be highly reliable, but how are you going to help them see that this behavior, like a bedside shift report that feels like an extra layer of work, is creating trust with your patient and making them feel like you care about them, because you do care about them, and then you get to enjoy knowing that they got that right. So it's really, we really strongly encourage getting very intentional about connecting the dots from the data reflect how people feel. And we've got to provide safe, high quality care. And these behaviors are going to make them feel safe and feel that we care about them.
Deirdre, I have to ask you this because you did mention it. The Press Ganey just had their annual conference like not too long ago. It was, I think,
Yeah,
last week.
last week.
What what was the highlight for you from that conference?
Oh, oh, wow. There were a lot. So we had 3,000 people. We were sold out. It was amazing. Oh, what was the highlight? This is going to sound, I don't know, so this was my 25th, because we missed one during COVID and I was on bed rest years and years ago. What I've always loved, and this year even surpassed, the energy in those rooms We have great content. We have great keynotes. We have great products. The energy in those rooms of the people who are so excited to take care of patients and to innovate. We had people who came to our conference whose organizations were on a travel freeze and they paid their own way to come to the conference because it's this community of leaders who are talking about how they're using AI or how they're anticipating our partnership with Epic is going to transform the way that they can provide care, how they've integrated high reliability practices across things, how they're helping their staff be well. Like it's a bit of a revival meeting, if you will. It's very exciting to be there.
It sounds wonderful. And I can well imagine because patient experience folks and anybody related, who works in that space in healthcare always seems to have that energy and that dedication to their craft so I'm not surprised to hear that some of them paid their own way to come to
Yeah.
your conference. Well, Deirdre, you shared a ton of great information with us today. Where can people go to learn more about Press Ganey?
Oh, certainly. So our website has a ton of information. So pressganey.com. There are lots of blogs and white papers that are freely available. Or anyone who is a Press Ganey client, even just individuals, anyone who's a Press Ganey client can also sign up for the Press Ganey Equity Partnership. That's a no-cost industry collaborative that we have to promote equity work within the healthcare space. So there's lots and lots of resources available on the website.
Fantastic. Deirdre, thank you so much for everything you shared today. Thank you so much for taking time out of your busy day to be with us.
You are very welcome. This was a lot of fun.
Hey, I want to thank Deirdre for coming on camera with me and talking to me about some of the more recent findings and statements that Press Ganey has made relative to the improvement in patient perception of the care that they're receiving. I was certainly encouraged to hear from her that she believes that this upward trend in kindness, is something that actually is going to be sustained. Maybe not at the same pace, but definitely that organizations are putting careful thought into how they are treating their patients, which I think is fantastic. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to Swaay.Health. That's Sway with two A's, .health, where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.